My name is Dr. Rubina Sheikh. I'm a family medicine doctor at Allegiance Family Medicine Clinic in Michigan Center, and I've been working there for almost 18 months now. Before I started at Allegiance, I was doing my training in family medicine at William Beaumont Hospital. I also have a master's degree in occupational medicine from University of Michigan. Breast cancer is a disease in which cancer cells develop in the tissues of the breast. And women in the United States develop breast cancer more than any other cancer, except for skin cancer. And it is also the second only to lung cancer as a cause of cancer death in women. It is estimated that each year about 200,000 women will be diagnosed with breast cancer, and approximately 40,000 will die of breast cancer. And since these statistics are so important, it's really important that we should develop an early detection plan for breast cancer. Women or men should know what their breast looks or feels like, and if they notice any change in the breast, they should contact their healthcare provider. I usually recommend my patients, especially women, to look for some of the warning signs of breast cancer, like if they notice any lump or hard knot or thickening in the breast tissue, or even in the underarm area, they should talk to the doctor about it. Also, if there's any skin changes like dimpling or puckering of the skin, or if they find their portion of the breast being red, warm, swollen, or darkening in the skin, they should inform their doctor about it. Also, nipple changes. If there is itching, scaly, sore, or rashes on the nipple, that can be a sign of breast cancer. Any nipple discharge that comes out suddenly and it's not stopping. Any pain in the breast that's kind of persistent and not going away, rarely can be a sign of breast cancer. Also, if they notice any pulling in of the nipple or any part of this breast tissue, they should consult their doctor about it. So if patient finds anything suspicious of breast cancer, they should contact their primary healthcare provider. And usually primary healthcare providers start out with clinical breast exam. And if they find anything that they think is important, they would order a mammogram. Most of the mammograms are good news, and they are usually benign. And it's estimated that approximately 8 out of 10 lumps that are found in the breast are benign, which means non-cancerous. If on mammogram, your primary care doctor finds that a lump which could be suspicious for breast cancer, he might order further testing. Most often the testing, follow-up testing, is usually non-invasive, and we start out with diagnostic mammograms or ultrasounds. And if diagnostic mammogram or ultrasound appears suspicious for breast cancer, the next step is to do a biopsy of that abnormal tissue to make sure whether it is or not breast cancer. If the biopsy finding turns out to be positive for breast cancer, it can be localized surgery with taking the lump out and giving radiation therapy, or it can be an extensive surgery depending on the type of breast cancer.